Spain by 2040, they predicted to be the longest living people in the world. And of course, they consume above the 10% recommendation, which still exists in some countries for saturated fat intake. And of course, the French aren't far behind. And these are countries that are living the longest. And so when we talk about dietary patterns, and you alluded to it here, but we had Dr. Stefan Van Fleet from Duke University on earlier this season talking about how the quality of one's diet influences, obviously, and the quality of the saturated fats and where they're coming from has a big influence on this. So could you talk a little bit about that diet quality piece? I mean, you have a chapter in the book around why cooking matters.
Going back to saturated fats, there is still some nutritional and epidemiological research connecting high saturated fat levels in a diet, a Western diet, with cardiac risk.
For sure.
But the problem is that they include things like palm oil, which is, it's now increasingly used in all, processed foods because it's like got great texture and it tastes okay.
Yeah.
It's really cheap. But that's, that is a cardiac risk, palmitic acid, palm oil. And that's muddied the waters as far as the sort of understanding of, natural saturated fats are not palm oil. They are, the saturated fats you get from dairy products and red meat. Towards the end of the book, I sort of give some just simple advice on, how to reduce your weight set point, not going on a diet, but actually just reduce the amount of insulin blocking leptin, the amount of vegetable oils blocking leptin, improve your cortisol level,
Mm-hmm.
And it's clean eating. Basically, the advice is to get your food from the butchers, the greengrocers, and the fishmongers. If you get your food from there, you'll be fine.
To go wrong, right?
And you'll lose a lot of weight if you're suffering. Yeah, chuck away the vegetable oils, and that's the main, and throw away the sugar foods and refined carbohydrates if you can. Just have it as a treat now and again. If you can do that and just change the way you eat, maybe not snack so much, a little bit of slight intermittent fasting or sort of 16-8 type way of eating, go towards that sort of traditional way of having 2 or 3 really hearty meals, not snacking too much between meals and having proper food. That's the type of eating that will actually change people's weight set points. So people, and I got a lot of feedback after the book. I've got hundreds of people who come back to me and say, look, I've tried this. It's like, I've lost a lot of weight. I tried all the diets before. So that's the clean eating thing. And, you can't really do it unless you take time to shop for fresh foods and to cook it. So, to look after yourself. I mean, actually, these days, you can actually get a delivery of fresh food. So you can get something like Gusto or Hello Fresh, which is actually great companies that will tell you how to cook the food. But you can't change your weight set point forever without, being able to cook. You have to be able to cook to be able to insulate yourself from this sort of environment outside in London or New York or wherever we live in inner cities or Western societies. You got to insulate yourself from that type of food by just cooking your own food.
Yeah, it is amazing how just by cooking your own food, all of a sudden the protein intake goes up and vegetable intake goes up and all these processed foods that we've talked about will decline. And so you naturally get this effect that you're after and you start to build some of those habits. And can we talk a little bit about muscle, Doc? I mean, it's interesting working with, NFL linemen or big rugby type players, some who are technically obese, but in their playing days are carrying loads of muscle mass. And so when we do look at their health markers and blood sugars and inflammation, all these, they're actually tremendous. But when they retire and the training goes down and the muscle mass comes down, if they don't change their ways, then we see these effects. So can you talk a bit about how muscle or even fitness can impact, insulin sensitivity, leptin and chronic inflammation?
Yeah, you probably know a bit more about that side of things than me. But certainly in the book, one of the main factors, apart from, our appetite in society, so, these signals telling us how much to eat and when to stop. The other side of things is the energy expenditure. And it's not just in the gym or, running for the bus or, being active around the office and walking to work and whatever. 70% of our energy expenditure is through our basal metabolism. So the type of energy we need just to heat our bodies, the chemical reactions, beating heart, perfusion of the immune system, these sort of things. 70% of our metabolism. And it's very, very dynamic. It's very sort of plastic. It can change a lot within individuals, depending on whether your weight is lower than or your weight set point is, or higher. And one of the studies in the book, we'll get onto muscle in a minute, how important this is as far as muscle is concerned. One of the sections in the book looks at these studies where they compare, for instance, cohorts of people who should have the same metabolic rate. So same age, same sex, same muscle mass, same heights, everything. They look the same. Mm-hmm. And you would expect from our medical training, we say, okay, we're going to put in a few factors into a complicated equation, and we're going to tell you that you've got a basal metabolism of 1,600 kilocalories a day. Then you add your activity, and then you can calculate, how much food you can eat in order to maintain or lose weight. When you look at the top 5% metabolizers in that cohort of people who are look identical, top 5% to lower 5%, there is a difference of 700 kilocalories per day between, just the basal metabolism. They can't help it. They can't do anything about it. This is the equivalent of a 10K run or a big 3-course meal. So this is why some people actually find it so easy just to maintain a normal weight and eat a load of food. And some people, not only do they have to be on a diet, but actually also have to go on to the gym, because this massive difference in basal metabolism, which can go up and down depending on, Now, the book goes into how our metabolism is changed, our basal metabolism. Again, not really very well understood by mainstream medicine and your average doctors. And there's two factors. One is the autonomic nervous system. So this is a thing that everyone knows. It's the fight or flight response. So if you're faced with a mugger or a lion or whatever, you're going to get your heart rate's going to start going, your adrenaline's going to start going, you're going to start sweating, you're going to be actually quite strong and fast, So that's a sympathetic drive. When you're scared, you're either fight or you run away fast. The other drive is a parasympathetic drive when you're actually very, very relaxed at home, listen to some music, maybe before bed, your blood pressure's down, you're not heating your body very well, you're preserving energy. Now you're ready for bed. That's called the parasympathetic drive. And that's how we traditionally understand the autonomic nervous system. But actually, there is quite a lot of evidence, if you look out there, that people who overeat get an increased sympathetic drive. So all the time, their blood pressure is higher, their pulse is higher, and they're heating their bodies. They're actually expending energy via this system. The system's not just used to be scared and run away or fight. It's also used, I think, to expend excess energy taken in, for instance, the Western diet. And again, when you look at people who have been on low-calorie diets, they have increased sympathetic drive. We know actually the best thing for treating the blood pressure is go on a diet. And this is the reason it increases sympathetic drive. And that autonomic nervous system is one of the main strategies the body uses to try and keep us within this weight set point, depending on, even if we're overeating or undereating, it will just change the amount of energy that we're using. The second factor that I've sort of looked into as far as, metabolic adaptation is where we get into the muscle, okay? And this is something called sarcoglycan, which is in skeletal muscles. So there's a lot of research out there. I mean, I'm sure you've touched on the research in your studies, in your books, on brown adipose tissue. So brown fat in particularly mice, small rodents. Their surface to weight area, they actually get very, very cold unless they have little internal warmers. Mm-hmm. Their brown fat actually works as a conduit to convert food energy into thermal energy, so that it just keeps them hot. So a little bit like the Ready Brick advert, you can imagine that. It's like it just keeps them warm, a little internal heater. Mm-hmm. We know that humans also have brown fat, particularly babies. So the smaller you are, the more brown fat ratio you have. In adults, it's not really quite as significant. But the researchers are crazy to find something out of that brown fat and actually stimulate it, because if they could do that, then we would be able to have almost like a dietary or a way of manipulating our metabolism to just burn off a load of energy so we could lose weight. And there's been some, I'm sure you looked into it, so the only way of stimulating it is to put someone in a freezer for
I was going to say,
basically
cold. Cold immersions.
Cold immersion. So that is not going to become a mainstream therapy. But actually, there is increasing evidence that the skeletal muscle has a type of brown fat, so a type of mechanism where food energy or chemical energy from food can actually be converted into thermal energy. It's called thermogenesis. It's an uncoupling of the mitochondria, ATP, in the mitochondria, in the cellular sort of engine. So this is a really, really important way that, again, we can burn off energy seamlessly if we overeat and not put weight on. And again, that's switched off if we go on a diet. And the other thing that the book looks at, as far as muscle is concerned, is if you're very sedentary, you don't do any exercise. If it's almost like a cultural thing that you don't do any exercise, and we look at the example is, particularly women in the Middle East, culturally, they're not really supposed to do a great deal in the daytime. A lot of them have help. They don't even have to look after their children. They just sit around. And they get sarcopenia, so they get a muscle wasting. Yeah. And these are the women who actually suffer the most with obesity in the Middle East. So over 50% of the Arab population, female, are now obese, over 50%, with about a quarter of the population diabetic. And a lot of it, I think, is due to sarcopenia. The only exercise they get is going around the shopping mall. But
it's tough. I mean, the muscle obviously a sponge for glucose, and it's.
I'm actually going to be studying your book, Marc.
Appreciate it. Nice.
Which I just bought because actually, I mean, my book didn't really delve too much into muscle because I think it is very important. But I'm going to try and learn a little bit more and see how I can fit some of my ideas with your ideas in that.